Good day. My name is Kay, a student nurse from the University of San Agustin here in Iloilo City. Today, I will be doing another return demonstration about fundal height measurement. Fundal height is a vertical or the up and down measurement of the mother's belly. It is usually used by tape measure and it is measured in centimeters. It is the distance from the pubic bone up until to the womb or the uterus. The next step is to identify the patient. Good day, ma'am. I'm your student nurse for today. May I know what your name is? Okay. Can you state your age and birth date? Okay. So the patient's name is Mrs. B, and her age is 29. Birth date is July 13, 1992. So I already did perform the hand washing earlier. Hand washing is one of the most important steps in doing an examination or procedure because our hands contain microorganisms that could lead to infection and even cross-contaminate to our patients. For the maternal consent, Mrs. B, this procedure is painless and won't take much of your time. I'm just going to measure using the measuring tape. Would that be okay? Thank you, Mrs. B. Encourage the patient to empty the bladder. Mrs. B, would you like to go to the comfort room to urinate first before proceeding the examination? Okay. The reason why we need the patient to empty the bladder because a full urinary bladder can change the fundal height measurements and thus be a source of false positive variations in the progression of the fundal height. For the position of the patient should be in a supine position but not too flat, and the feet should be extended. Ensure that our hands are clean and warm. So I'm just gonna put some antiseptic disinfectant or an alcohol just to be sure. And I'm just gonna warm my hands. Mrs. B, I'm just gonna open your blanket and I'm gonna lift up a portion of your gown. Place the 0 mark of the tape measure at the uppermost border of the symphysis pubis or the uppermost border of the uterine fundus. Run the tape measure along the midline of the woman's abdomen to the uppermost border of the uterine fundus or the uppermost border of symphysis pubis. So our result is 25 centimeters. The distance is measured from the top of the symphysis pubis to the depression in front of the pad of the middle finger. So it is 25 centimeters. I'm just gonna close it, Mrs. B, because we're done already. And put on the blanket back to its normal position. After measuring the fundal height, we must document it and compare it to the calculated gestation. So the result earlier was 25 centimeters, which is 25 weeks.